Cory Gardner right now joins us out of Denver, running against Betsy Markey, of course, one of the Democrats who could be a very vulnerable after this. You're watching the scene right now on the House floor. Do you have a sense right now, Cory, that this issue resonates? In other words, that anyone for this health care plan is vulnerable?
Yeah, thank you, Neil. Very much so. People in the 4th Congressional District of Colorado are simply outraged that the Congresswoman, Betsy Markey, has decided not to listen to them and instead voting for the bill. She is clearly not listening to the people of her district and clearly out of step with the desires of the people in the 4th Congressional District.
But she's not alone. She's not alone, right, Cory? I mean, and there are many others who are saying, look, we have nothing to lose here, unlike in 93, 94, when we never ended up voting on anything. At least now, tonight, we are, and now tonight we're likely victorious, and now tonight we can come back to our constituents and show them what we did and what they're going to get out of this, and they've got time to explain, and you're the one in trouble, not they. What do you think?
Well, and I disagree with that. I think, quite frankly, the people of this country understand very clearly what's happening. They understand that they're being taxed for 10 years to pay for 6 years' worth of a bill, that 17,000 new IRS agents are going to become storming their states to implement this legislation. And so they know what's going on, and they are outraged. And our phones have been ringing off the hook. We've sent out press releases. We've had press conferences and teletown meetings, all to explain that Betsy Markey is out of step and out of touch with the people of her district. Neil, this vote very well could come down to Betsy Markey's vote. And I am here to say no. I'm here to say we've got to stop it. We've got to listen to the American people, the people of Colorado, and keep this thing from moving forward.
But there is this notion that if this thing is structured, a lot of the good stuff, at least for most Americans, and if you can call it good stuff, but a lot of the more favorable stuff takes effect immediately. And by that I mean coverage for previous conditions, medical conditions, not for adults but for kids. That would be immediate. Preventive care measures that would be covered with a zero deductible. That would be immediate. Coverage for your kids up to 26 years of age to stay on your policy. Another compelling reason I might point out for my daughter never to leave home. But in other words, all that starts to be. Now, you're quite right that a lot of the onerous stuff, including tax hikes and the like, they kick in. But the Democratic argument is, yeah, but for a small section of the public, not you. What do you say to that? That's what Democrats are going to bring home to their constituents. All the goodies, it reminded of all the goodies, and this was us, and it was the Republicans who tried to stop us. What do you say?
Well, Neil, I think, again, this is a case where the people really do understand what's going on. There's a number of people who aren't even going to be affected by the provisions of the bill that do go into place immediately. And so the people who understand the cost of this, that it's going to be a $2 trillion bill, I mean, this is coming from the same Democratic Party and the same member of Congress in Colorado that a year ago was saying when they passed the stimulus package, they'd keep unemployment below 8%. And look what's happening. Now they're saying that the health care bill is going to save money by spending $2 trillion. The numbers just don't add up. It's new math, and the people of this country are smart enough to figure it out.
All right, we're going to watch your race very closely. It's one of the most scrutinized in the country, so thank you very much.
Well, thanks, Neil. Hope everybody can join us at CoryGardner.com if they want to fight with us.
Yeah.